Now this next segment, we are going to now show you how to do four-handed dentistry. So right now we have a patient here and we're about ready to get started. So what we're going to do is, normally I would just introduce myself, let the patient know what we're planning to do today, how much time it's going to take, and offer them to play a Netflix video here, which you can see right here with the headset there. But this focus is just mainly on the mechanics of how to assist the doctor. So all these other details can be discussed in a different session. So right now what I'm going to do is I'm going to lower the chair. And normally we would place a bib on the patient. There and then we would go and lower the chair. And then normally would offer sunglasses, because every doctor here at Perfect Smile has loops with a little light on there. So we always want to let the patients know that we want to make them comfortable and not to irritate their eyes with the loop light that we all wear. So that is just automatic with every patient you run into. Now it's very key that, and also we're going to assume that we already got the patient's numb, everything's ready to go. So now we're going to go ahead and get started. So you can see here, this is the high-speed handpiece, and we will go ahead, patient's already numb. We already went ahead and got started. Now this is the type of dent that we're going to be working on, pretending that this is a patient. And what we normally do is, for the sake of just to get an idea, the reason why we have cotton and gauze and triangle is, I'm going to simulate pretending that, you get a triangle please, that we're going to work on tooth number 31. So normally on the bottom teeth we always place a cotton on the lingual side, and we would normally place a cotton on the buccal side just to provide retraction. Now some doctors prefer, and then of course prefer just using a triangle alone. Key thing is that as an assistant you want to be aware that a triangle is always exclusively used to make sure to keep the tongue protected while the doctor works. Some will go ahead and place a cotton in there, some will not. For the sake of simplicity, just make sure that you offer the doctor a triangle to make sure to retract the tongue and to protect the tongue, both on the lower right and on the lower left. And then on the buccal side will be the cotton roll. Alright, and this is where the assistant will have more freedom to place their high-speed suction so that they don't injure the tongue while the doctor works on the tooth. Which is basically, I want you to also pretend that I'm working on tooth number 31, making a class 2 prep right here. Alright, and that is what I want you to be able to visualize. Now if this was on the upper arch, obviously a triangle would be used differently. On the upper arch, the triangle would be placed towards the cheek side. Again, as an assistant, your job is just be able to always be prepared, knowing that a triangle is always needed before they start any type of preparation. There's the blue one, and there's another one that's yellow. Blue one is a bigger size. The yellow one is a smaller size. Doctors will always let the assistants know what size they are specifically wanting. So after the tooth is prepped, I'm going to go ahead and proceed with now going through the mechanics of how to place the composite. So right now I have a mirror in my hand, and normally the doctors will work this way, and as soon as they finish preparing the tooth, there's no pretending that, let's say, oh, there's still a cavity left behind. Then they'll ask for the snoop die. Alright. And this is how it looks. And normally what we do is, to make sure that there is no caries left behind, you just go in there and apply a little bit, just for the sake of illustration, just pretending that we apply it there. And then the assistant immediately makes sure that they wash it, turn it on, and that's how it's to be done routinely. and that is what the doctors will, each of them want. Some of them will be able to tell pretty quickly that there's no caries left, but about 90% of the time, 100% of the time, they normally would like to do this to make sure that there's no caries left behind. Okay. And then as soon as that has been checked and it's been confirmed there's no caries left behind, then we move on to placing the restoration. So right now, we will simulate, once again, how to isolate the tooth properly. The way it works is we place a cotton roll right here on the lingual side, another cotton roll on the buccal side, and then fold a piece of gauze into a square like this, and then place it way in the back, as far back to the as distal of the last tooth as possible. And this is what it would look like in the patient's mouth. Again, this is a typodont, so it's not possible to simulate it 100%, but visually you can see what it would look like if you were to help assist a doctor work on either the lower right or lower left quadrant. In the upper quadrant, it would be a little bit different. You would only have one cotton roll on the buccal vestibule, and then a square gauze placed distal to the very last tooth. The purpose? To keep everything dry. Dryness is very critical, and it's very important. As an assistant, you know that, and provide these materials to your doctor in a timely manner, because patients' salivary glands are very active and won't allow the area to stay dry for long. So again, going back to the lower right, simulating dryness here just for the sake of practice, and what we're going to go ahead and do is proceed with now taking a picture. Now I apologize in advance. Before you take a picture of the tooth completely, where the cavity is completely removed, you always want to take a picture of the cavity first, and then continue removing the cavity until it's completely gone, and then you take a second picture to make sure that the patients can see how things look before the cavity is completely removed, and after the cavity is completely removed. After this photo is taken where the cavity is completely removed, the assistant will go up to the computer and then save the images. Now, again, for the sake of time, we're only focusing on just the mechanics of the assistant. As long as we'll go over how to do the technical part of the computer in a different session. The main objective now is just knowing how to do four-handed dentistry with your doctor. After the photo is taken, we begin by placing the primer. So as you can see there, Aldrin's already getting started there. The pink liquid is the primer, and the yellow liquid is the bonding. Now it's very important that you don't overfill it. You only need about a drop. No more than a drop is needed, and then we'll go ahead and begin. First of all, it's very critical that the area is completely dry, so the doctor or assistant, depending on how you work with your doctor, it's very critical that the tooth preparation is completely dry. And then once it's dry, you hand over the air water tip syringe to your assistant, and then he hands off the primer, and then we apply it into the area where we prep the tooth, and make sure that it stays on there for about 10 seconds. And the doctor needs to be very attentive to make sure that there's no water that comes out of the tip. And then we air dry it, air thin. After it's been air dried, we move on to the bonding. And doctors will make sure that there's not too much access, and then apply the bonding. Take about 5 to 10 seconds on the application. And then blows air on it, making sure that it's paper thin. And then hands over to the assistant, making sure we don't hit the patient's head. And then this is the UV light, and then the assistant will place the shield over the doctor, and then do the curing. And we cure the bonding for 20 seconds. And then always hand the flowable first, and we'll apply a small amount of flowable into the preparation, a very thin layer, and as soon as the doctor feels comfortable with enough being applied, always have an explorer handy to give to the doctor so that he or she can spread the flowable into the preparation. As soon as the spreading is completed, the doctor will hand the instrument back. Now be very mindful, there's still flowable on the tip. So it's very important as an assistant that you always make sure the tips are always wiped before you put it back into the cassette. Because once you forget to do that and it gets sterilized, chunks get left behind on the tips and its usefulness is no longer there for the doctor or for the assistant. And that just makes the work that much more difficult. So that would be done after the light cure has been handed off to the doctor. There'll be some situations where the doctor can actually hold both the shield and the light cure, or just hold the light cure. Again, this is just more out of preferences between doctor and assistant. It's just very key that the assistant is just aware of just a mild, minor difference. Then, always squeeze out about 3 millimeter increments of composite, no bigger than this. And then here is the condenser. And what the doctor will do is just go ahead and sweep out a little bit here and apply it into the area where the preparation was completed. Okay. And then once that's completed, sometimes some doctors will have to do 2 layers. So when there's 2 layers, they use a composite brush. Do not apply any more bonding. Just leave it the way it is. Doctors will remove however much excess bonding is left on the brush and then just pack it in for the first layer. Some doctors may not need this. So again, that's just a very small thing just to be aware of. But in most cases, this is what they need if they want to make sure they get a nice solid condensing, packing of the composite into the prep. And then it gets cured for 20 seconds. And then after it's cured for 20 seconds, they do another layer. As an assistant, you can see the preparation. You know that it's not going to be a 1 layer composite. Scoop up another. Go back right in. This is the second layer for bigger cavities. And then we use the acorn to carve the anatomy. You can see the acorn burnisher. And then they would just go ahead and carve the anatomy. And then hand a bonding brush, only the bonding brush. You notice he's only giving me the yellow one, not the red one. And just to remove any excess and do any fine carving. And then we cure it for 20 seconds. And then that's it. And then we start off by using a football burr to adjust the occlusion. You can zoom in here. And this is what we do to do the major occlusal adjustments. Okay. So, and then of course after the occlusal adjustment, the assistant will always dry the tooth, and the patients will bite onto the articulating paper. Now the way this would work is sometimes after they dry, go ahead and dry the tooth. After the tooth is dried, the assistant can hand, and the doctor can make sure the patient's still open, and then you can hand over the articulating paper and just make sure they bite, and then they'll check to make sure, and we adjust it as necessary until the patient feels comfortable. Once that's completed, as an assistant you need to know this. You can replace it, the slow speed round burr, with the polishing burr. And then you just use that to just polish the surface to make sure it's nice and smooth. And it's very critical that during the polishing, it's very important to apply little bits of water just to wet the tooth a little bit, so that as the doctor's polishing the tooth, you apply just wet the tooth only. You don't have to flood the tooth. The purpose of that is twofold. One, it provides a finer finish, and number two, it doesn't burn the tooth, because this can generate a lot of heat if there is no water on the tooth. Alright, and then as soon as everything's complete, we take and we wipe off all of the marking paper, make sure that there's no blue marks there, and then we take a photograph of the final preparation, a final restoration. And then once that's completed, we take everything out, rinse the patient just a little bit, and then we bring the patient up, and then let them know that that they did a great job, they did very great. Make sure we encourage them, because it's not easy for them to sit and lay through the chair for 45 minutes to an hour. And then we show them the photograph, and then from there we walk the patient to the lobby and talk about what is next on their treatment plan. Now this is for what I just showed you now was a class 1 composite. Now all these steps are very much the same. There are some variations when we do a different type of restorations. For example, we're going to move on to a class 2. What we did was just class 1. Now we're going to move on to a class 2. The only difference in the class 2 is that as soon as the cavities are completely removed, we move on to placing the sectional matrix band. What we do is we place it right here. And you can see Aldrin's already know that this is just a DO on number 31. And what the doctor will do is make sure that they place a little sectional matrix band right here interproximally. Again, this is on a typodont. Always want to make sure that as an assistant you're aware the first step is placing the sectional matrix band, and then the next step is placing a wedge. And then the third step is placing the ring. Okay. And then next, always make sure you hand either an instrument that has a round tip, such as this condenser, because the doctor always wants to burnish the sectional matrix band to ensure that there is a contact when they do the filling. Alright, then they go back, mirror is held, we air dry the tooth, and then we go ahead and take a picture. And then from there we proceed as normal. Place the primer, the bond, the flowable, and the packable. Okay? And now let me show you another situation. If it was a class 3 on an anterior tooth, again, the only difference is just the materials that we use. So let me just go ahead and get the mylar strip. So what we use is, after the cavity is completely removed, preparation is complete, then we go ahead and apply the mylar strip with a wedge. Here it is. The assistant has that ready. And everything's in a tub right over there. So anytime you need to grab something and need to make an adjustment, it's all there for you in the little containers there. Place it in here, and then normally we prefer a wooden wedge, and place it right here. And then of course, as soon as that's completed, make sure the tooth is dry. We take a photo before we begin. The area being completely covered. After we take the photo, then we start the whole process again. Prime, bond, and just flowable, and then the packable composite, and adjust it as needed. Now in this situation, most situations, instead of the condenser, we use what's called a plastic instrument. So when you hear the word plastic instrument, this is what you should be grabbing for your doctor. And most doctors prefer this angulation, where it's nice and straight this way and this way. There is another type where this is angled differently. Some doctors may prefer this, another type of plastic instrument, where it's more 45 degrees and slanted in a different angle. Okay, again, that's the job between the doctor and assistant to know these small differences in terms of how to apply the Class 3 composite. Alright, and then lastly, a Class 5. The only thing that makes this different compared to a typical composite is that we do place retraction cord. So Aldrin right now is heading over to the composite tub. Again, all of these are in these small containers. What we do is we'll place the retraction cord. And normally we would pretend the number 20 needs a Class 5. And we place a little retraction. We always normally place a retraction cord about 90% of the time. And then we use a cord packer. Just make sure we pack the cord. That way you have a clear understanding of the reason. And the reason for this is because a lot of the times the area where the abfraction is located is sometimes partially covered by the composite. By the gum tissue. So we want to make sure that we track the tissue as much as we can so that we can get a 100% view of the abfraction, and then we just prepare it just like we would with the other types of preparations. Make sure it's completely cleaned. Now with Class 5s, it's very different from the Class 2s and Class 3s. Here we use the etch, and you can see it's blue. And what we do is we make sure that before we apply it, we make sure we isolate the tooth just like we did on the other ones, where we place a cotton roll on the lingual side and also a cotton roll on the buccal side. If it was on a bottom tooth, upper tooth would just be a cotton roll on the upper, because we want to make sure we keep the tooth isolated and dry. And then the tooth is dried, and we apply the etch on the enamel part. It takes about we apply for about 10 seconds, and 10 to 15 seconds, and then the dentin part another 10 to 15 seconds. And then once the blue gel is applied here and the time is up, we water it. We're going to shoot water in there. Then we're going to turn on the suction, please. And just splash water in there, and then we have to dry it. And after it's dry, let me turn that off, please. Normally the cotton roll does get wet, so we always replace it with the dry one just to ensure it doesn't get any moisture. Not always necessary, but again, as an assistant, that's just something you want to be aware of. And then we apply the bonding, and then we air dry it. Again, same thing, same principle as we did with the steps here from the very beginning. And then we cure it for 20 seconds. Then after that, apply just a drop of flowable there just to make sure that all of the crevices are filled. And we use an Explorer. Always use an explorer to spread the flowable around. And then we cure it for 20 seconds. And then we place the packable composite. Just basically scoop up the composite and then just apply it into the area where the abfraction is located, and the doctor will pack this in. Okay. And then we'll cure it for 20 seconds. And then they're done. And then as soon as the filling is completely cured, then we go ahead and remove all of this and then start making adjustments. Now there's only one situation where additional curing is involved, which is on the class 2. On the class 2, all doctors will remove the ring and twist the matrix band out, the sectional matrix band out, give it to the assistant, and then cover the doctor's eyes, and they will cure the buccal side for 20 seconds and then the lingual side for 20 seconds. And then the curing is complete. And this is only, again, I emphasize again, only on class 2 composites where the ring and the sectional matrix band was used. All other types of composites, it is not done. Only on class 2s. Then everything gets taken out. The assistant's holding the cup to get all of the materials. Now for retraction cords, we go right inside. Assistant's aware of what the doctor needs. Hands over the explorer, takes out the cotton roll, the retraction cord, and then that's it. That's only for class 2s. Okay. And so now that all the restoration is complete, for class 2s, class 3s, even class 5s, we go ahead and adjust it with the football burr. And then be aware with class 2s and class 5s, there is the cone-shaped burr. And the purpose of the cone-shaped burr is to remove any sharp edges and rounding the corners on a class 2, or getting into areas to provide more definition, because we don't want the composite to look like a box or a flat shaped restoration. We want it to look like the natural tooth as much as possible. And again, these are the 3 that adds beauty to the restorations: the cone-shaped burr and the flame-shaped burr, red stripe. Okay, and this is what doctors routinely use to get into the areas to make sure that there is no jagged edges here. Sometimes on a class 3 they want to make sure that it makes a nice smooth definition here. Even on a class 5, doctors want to make sure that they can make sure that the composite is flushed and there's no overhangs. Okay, and as soon as that is completed, we make sure that we polish at the end of all restorations. And as an assistant, your job is to make sure that after that the tooth is slightly wet every time. You don't flood it, but you want to also make sure it's not dry either. You want to make sure that you just wet it. I'll go ahead and wet this. Let's wet this tooth right here. And see how Aldrin just wet the tooth there? Wet it again, and then just. Okay, and that's how we would want to proceed with the polishing. And as soon as the polishing is done, we wipe off we take all the gauze out, make sure we wipe everything, make sure that there's no blue marks left there, and then we take a photograph, final picture of all the restorations we've done, class 5, class 3, or class 2. And then, very critical, make sure that the dental floss is there for the doctor so that the doctor can check with the floss, make sure that there's contact on all the class 2s and class 3 composites. Okay? And that concludes the session. And then we bring the patient back up, and then we explain to them what was done in the photos, the little before and after photos, because that's the key to what patients need to see. Is they need to see that they really needed the dental care that we recommended for them, and also help them to see the benefits that they received in the care that we provided. And of course, at this point, we go over post-op instructions and let the patients know that what their next treatment is when we walk them to the lobby. It's very important that the patients hear from the doctor, next from the assistant, and next from the person in the front, what the next treatment is. Very important. Okay? And always make sure you always let them know that they did a great job, because patients actually are doing a great job in getting through these procedures. We always want to be encouraging. So right now, this is the general mechanics of how to do composites. And if you look in the tub, all the materials that Aldrin just provided for me is all there. It's just some for review. And here is also a sheet right here in written form where it says Class 2 Composite Protocol. Everything is in here, and it'll explain to you step by step how to just set up and how much time is needed for certain steps. The most important thing as an assistant is you need to be aware of is, why do we cure with this much time? Well, first off, if we don't, patients are going to get postoperative sensitivity to temperature and cold. So it's very important that the doctors cure the full 20 seconds. And also, especially in the class 2 composites, they cure all those surfaces. Number 2, why does the doctor need flowable? Well, if they don't apply the flowable composite before they pack the packable composite, the patient will have postoperative sensitivity. And in the end, if there's postoperative sensitivity, it's considered a failure in providing good service. So it's very important that all of these steps are followed in detail. And as you get used to this, you'll get faster and faster at it and be able to work faster and faster with whichever doctor you work with. All right, so that will conclude the session. And the small point for basing, all you need to know is that this is only applied for deep cavities. And this is always applied before you apply the primer. That is all that needs to be known. And that is something, again, the doctor will let the assistant know whether they need this or not. This is not very common, but it does happen enough where you do need to know if this is something that you need to apply before you apply the red primer. All right, so that concludes the session, and this is how it's to be done, four-handed dentistry.